If you have a vision you can articulate that will change healthcare for the better, this is the place to work because we will embrace it.
Welcome back to the Bobcast. I'm your host, Bob Riney, President and CEO of Henry Ford Health, and today's conversation goes straight to the heart of healthcare. I am honored to be joined by Dr. Rana Awdish, an extraordinary physician, best-selling author of landmark medical memoir, In Shock, and one of the most important voices in medicine when it comes to compassion, culture, and the human experience of care. Rana serves as our medical director of care experience at Henry Ford Health. She leads our pulmonary hypertension center for comprehensive care. She is triple board certified in internal medicine, pulmonary, and critical care, a clinical professor at both Michigan State University and Wayne State University. She's also been nationally recognized for her leadership, including being named a U.S. News and World Report healthcare hero during the COVID-19 pandemic. Through her work, Rana challenges all of us, from administrators to clinicians, to rethink what healing truly means, not just clinically, but emotionally and culturally. Her upcoming book, Aftershock, continues that exploration in a deeply honest and powerful way. She is literally one of the people I admire the most, a true game changer in healthcare, and someone who has taught me personally so much. Rana, welcome to the Bobcast.
Thank you so much.
You had quite a serious illness at the end of your fellowship training that in many ways changed your career trajectory, probably your life trajectory. Could you lay that foundation for listeners who may not know?
I'd be happy to. Literally at the end of my pulmonary and critical care fellowship, I became a critically ill patient. I had a tumor in my liver that ruptured, and it was an arterial bleed. So I effectively lost all of my blood volume into my abdomen in a matter of an hour. I was 7 months pregnant at the time. That bleeding compromised the baby, and we lost the pregnancy. And I found myself really in my own hospital in multi-system organ failure, in shock, and getting to see medicine from an entirely different perspective. There was a real difficulty I saw in my care teams knowing how to manage some of the non-medical aspects of my healing, the emotional trauma, the psychological burden of loss and suffering. And I really felt from that moment, if I did get well enough to come back, that was the space I wanted to work in.
Prior to this incident, did you see yourself as a teacher, but maybe a teacher in a different way? Or was it this experience that solidified the need for you to teach?
I think before this, I just thought I would be teaching ventilator asynchrony and hemodynamic management and pressors. And I didn't as much value the space of teaching communication. And what I found with my own experience is that one without the other is completely incomplete. You can't teach medical students and residents and fellows how to manage patients as if they're bodies and not full people.
So interesting aspect of medicine historically was there was actually a belief that you had to a certain extent, keep yourself distant from the patient's story because it could be too emotionally draining and take you away from the objective kind of dispassionate look at what their clinical needs are. And you've sort of shattered that belief.
You know, in fairness, that belief, I think, came at a time when physicians weren't allowed to be fully human. They had to compartmentalize. They didn't have the kind of resources that we have now. We have safe spaces for our own decompression now. We have communities. That allows us to go more fully into the lives of our patients and families and not be depleted by it.
Tell me a little bit about the receptivity that you've experienced as you've gone on this journey of sharing your experience and educating others. What about people that came in with a critical view?
The biggest critique I think I get of the work is everything you're advocating for takes so much time. If we have to listen to people, oh my goodness, I'll never get my notes done. And that's been really easy to disprove, thankfully, because that kind of efficiency just solves itself.
When you first started this journey, especially in writing your first book, there was some reflections on imperfections within Henry Ford Health itself, because that's where you got care. Were you worried about the reaction of your employer, and how did it go?
So I live with an attorney. The first clue I had was when he sat me down after reading it and said, I need you to expect to get fired.
Wow.
And we had to sit with that and talk about it and the impact it would have on our family and decide to still go forward. And I made the really hard choice not to offer it up for editing before it was bound, because I didn't want it to be changed in a way that was untrue. I just had to stand behind it. And what I learned about us is that we own our identity as a learning organization. Every single thing that I saw in my care happens everywhere. But we were brave enough to say, it's not just us, you guys, and we're going to lead the charge on making the change at a national level.
I really hear your answer with great pride, because I do think that Henry Ford Health is unafraid to go there if it's for the betterment of patients, the betterment of our communities.
If you have a vision you can articulate that will change healthcare for the better, this is the place to work, because we will embrace it.
My observation is that you've found a way to blend work-life balance so that they're not compartmentalized or separate, but they're synergistic with each other. Is that a fair observation? And was that the case prior to your trauma, or did that come after?
So what your question brings up for me is a memory of the first time I was driving back to work after I was so sick. It had taken me 6 months to recover, all the learning to walk and talk again. I had to come off all of the narcotics to manage the pain. And I was driving to work, and I was filled with such a sense of gratitude that I was healthy enough to drive to work, and that I was going to get to take care of patients, and then I was going to get to come home. And like I had recovered my life. And I really intentionally hung on to that sense of gratitude. It isn't lost on me that we need our bodies to be able to do the work that we want to do. We need our bodies to be healthy. And to have that gratitude at the center just makes everything feel like a gift.
Communication is a theme that you talk about and weave into every single conversation as probably the biggest determinant of a relationship between a provider and a patient, and then a pathway for good outcomes. So tell us a little bit about your learnings on communication.
We get to hear from patients about what went wrong. And more often than anything, the medical care goes perfectly, and there's some miscommunication that really nestles in them and hurts. And we get to take those learnings and put them into our courses. When a physician says, your mom needs to be intubated, that takes power away from the family. What we propose as an alternative is, your mom's breathing is getting worse. Can we talk about what that might mean and what we can do from here?
Big difference.
It is, and it just redistributes power to them. It says who she is, her story matters.
Where do you think medical schools are on their journey of having a contemporary learning experience that matches what your experiences has told us is the need?
They're doing so much better than when I was in medical school. There is intentional team-based training on communication. They are even selecting students that fit with a high EI phenotype. They are thinking about this upstream. Our job now is not to break them when they get into healthcare.
I want to ask you about the partnership between physicians and nurses. Tell me a little bit about the evolution of the role of the nurse in partnership with everything you're describing.
Nurses have my whole heart. When I think about my learning about how to communicate, the best examples come from nurses because they have a much more whole person view of how to care for a patient and their family.
They're spending a lot more time.
They are in the room, they're hearing the side conversations, they're hearing the questions, they know what the patient and families don't ask us. They are the center of care, and when I see patients, I think of myself more as just a hub that receives information from the people around me, the respiratory therapists, the nurses, the social workers, and helps to integrate it into the medical care plan. Without receiving all of those inputs, the care is incomplete, and nurses are right there at the top.
You have a new book coming out, Aftershock, and it's coming out in June. Tell us about when you decided it was time for writing another book and what you hope the message will be from this one.
My learning has grown and changed over time, and I really found that I needed to move the conversation forward. What I learned about myself in the process of writing it was I had ceded my healing to medicine. I esteemed medicine so much that I just figured however healthy medicine can get me, that's how healthy I'm going to get. And I didn't take responsibility for the emotional healing or recovering from the PTSD, or really even learning not to view my body as a ticking time bomb. What I hope that patients will take away from this next book, and doctors too, is that the body knows so much more than we give it credit for. It is a partner in healing. Our stories are a part of our healing. If we tap into it and don't disregard it, the healing potential is limitless.
Rana, it's been just a joy to have you on the Bobcast, and more importantly, I can't thank you enough for the role that you are playing to change the trajectory of medicine. You bring joy to me, and I am so grateful that you are such a key part of Team Henry Ford Health.
Thank you.
The real deal is a phrase that can be often misunderstood or misused, but Rana is the real deal. I mean, she has taken all of her life experiences and channeled them into making a positive difference. And she does so with ease. She does so with non-judgment. She does so with passion. And she does so with conviction. Her role in evolving medicine cannot be overstated. She is a person of impact. And I hope you enjoyed listening to her as much as I enjoyed talking to her. If you enjoyed this episode, please click follow so you will never miss a future episode. Share us with your friends and leave us a 5-star rating and review, which will help others find us. If you have suggestions for a topic or a guest, email us at bobcast@hfhs.org. Remember, every action we take today is a step towards the future we're building together. Let's keep striving, keep believing, and keep moving forward. Let's use positive momentum to carry us through an era that's filled with troubling questions. Until next time, take care and keep making a difference.